Hello, we'll be talking about the access to SRH information and care for young people during the COVID-19 pandemic, and we'll be presenting the Albanian case. The COVID-19 pandemic is one of the most recent global public health emergencies, which placed the world in front of new situations and challenges. The pandemic demonstrated the weaknesses of health system and exposed the fact that countries are not prepared to deal with health emergencies. Many health systems, due to the anti-COVID measures, resulted in the deprioritization of health issues and services, including those related to the sexual and reproductive health. There are no clear indicators that globally the COVID-19 pandemic affected the access to information on a wide range of topics related to the sexual and reproductive health and the provision of the SRH services. Almost in all European countries, pandemic had a negative impact on the provision of the SRH care, including those for young people. The impact of young people, of misinformation about SRH issues, barriers of obtaining information and accessing SRH services have been underestimated or overlooked during the COVID-19 pandemic. Based on this, an in-depth analysis and a better understanding of the impact that crisis situations such as the COVID-19 pandemic had on young SRH was required. In this context, the International Planned Parenthood Federation, the European network, coordinated the study in the framework of the Youth Voice, Youth Choice project, which was implemented by the Albanian Center for Population and Development in Albania and supported from Merck through its Merck for Mothers program. The study aim was to better understand the impact of the COVID-19 pandemic on young people access to SRH services and information and identify ways to address their SRH needs as well as to contribute to more accessible and SRH-friendly services for young people even beyond emergency situations. Regarding the methodology, there were 4 phases. The first one was a review of the information available, containing official statistics, reports of research, media reports, etc., which provided valuable information and identified the issues for further investigation in other phases. The second phase was a focus group with discussions with young people and one-to-one in-depth interviews with experts, stakeholders in the area of SRH, which helped identify the issues for measurement in the quantitative study of a phase 3, which was a structured questionnaire completed by 340 young people online or by an interviewer in face-to-face interviews. An in-depth interview, a review of research findings served to prioritize those practices which address the unmet SRH needs of young people. The target audience were young people of age 40 to 30 years old who reside in the main urban areas of the country, and respectively 152 young people were from general population, while 188 young people were from vulnerable situations. Regarding the main findings, first of all, we understood how the perception of SRH information seeking were in the young people, and there was a statement that pandemic is perceived by youth as having eclipsed all other health issues and information requirements, including the SRH issues, and this was agreed by 51% of young people. Regarding the information seeking on sexual and reproductive health, a significant proportion of youth reported a real need to source information for SRH topics during the pandemic. 74% of the females and 55% of males reported having sought information on at least one SRH-related issue during the pandemic, and we can see from the graph that mental health, psychological well-being was the first one, followed by gynecological health, sexual intimate relationship, and so on. Which were the channels for seeking the SRH information? Actually, the data analysis showed that young people use a variety of information channels, such as website, blogs, apps, social media, and there was also an increase in use of TV and radio, and friends were also on reliable channel. While the WHO website and other medical sources were not so used by young people during this period. Regarding the proportion of young people who needed information during the COVID-19 but could not obtain it, we can see that this was particularly a problem among youth in vulnerable situations. Limitation on the required information was related to fertility, pregnancy, sexual and intimate relationship, STIs, and mental health. But also it is noted that the lack of information does not have strongly impacted young people on an emotional level. Regarding services needed during the COVID-19, we can see that the range of services were gynecological and routine checkups, counseling on sexuality relationships, family planning and pregnancy, and then contraception and condoms. Perception of SRH services, we can see that 75% of young people stated that COVID-19 really showed the importance of having a family doctor you can trust. 53% of young people stated that the need for sexuality, comprehensive sexuality education were made more visible, and it evidenced that SRH services do not adequately address the needs of young people. This was stated by 38% of them. Moreover, most adolescents believed that they should have their peers with them to receive the necessary attention when seeking the SRH services. There were some difficulties in accessing the services. Actually, there were two main areas which were found more difficult to access during the COVID-19: gynecological checkups, testing, and sexuality and relationship counseling. Another component that was identified as a big issue during the COVID-19 was sexual and gender-based violence. Actually, 90% of young people in vulnerable situations and 30% of young Roma stated that they personally experienced or witnessed an incident of sexual and gender-based violence. There was a consequence that COVID-19 actually led to an increase of statistics related to sexual and gender-based violence, but there were also positions that stated that actually the quarantine led to an improvement of couple relations and decreased sexual and gender-based violence. When we talk about seeking support of sexual and gender-based violence cases, 36% of them experienced SGBV did not seek support, did not know what to do or where to seek the support. And actually the main support was given by NGOs and the youth support group, as it is shown in the graph, and also effort to contact police or shelters has been significantly low. And furthermore, the extent to which these needs have been met when they had sought help has been insufficient. What are the main conclusions that we can come up from this study? Efforts to address the COVID-19 have been dominated all other health issues, including the ones regarding the youth SRH services that were not given importance or were considered of low priority. Several aspects need to be considered during the implementation and planning of policies programs that address the young people's need during the crisis times. And during these crisis times, actually, there is a necessity to continue raising awareness to maintain young people access to SRH information. This consists on comprehensive sexuality educations, which needs to be adapted and updated based on a changing context, SRH services, which must continue to be provided at least at pre-crisis levels, and reallocation of health sources during time of crisis. Sexual and gender-based violence mechanisms should be structured to be available also during times of crisis. Thank you.